break agreement. Listen to him. Remain where you are.
Okay. All right. So I am deeply honored to join you this morning for the official launch of the Ghana Medical Trust Fund, Mahama Cares, as it's called, a landmark initiative introduced by my government to decisively confront the growing burden of chronic non-communicable diseases, for short NCDs. The fight against NCDs is intrinsically linked to our broader national development agenda, particularly the Sustainable Development Goals and most notably SDG 3, which enjoins us to ensure healthy lives and promote well-being for all at all ages. Specifically under SDG 3, Target 3.4, commits the global community to reduce premature mortality from NCDs by 1/3 by 2030 through prevention, treatment, and promotion of mental health and well-being. Across the globe, non-communicable diseases, including cardiovascular diseases, cancers, chronic respiratory conditions, diabetes, and mental health disorders, remain the leading cause of mortality, accounting for over 43 million deaths annually worldwide. Worryingly, the burden is disproportionately borne by low and middle income countries such as ours, posing not only a public health crisis, but also a profound social and economic threat. Non-communicable diseases exacerbate poverty, they widen social inequality, and undermine economic development. Vulnerable populations, that is those with lower education, limited access to healthcare, and lower income levels, are currently most at risk. Addressing the NCD menace is therefore not merely a health imperative, it is essential for advancing economic growth, promoting social justice, and securing environmental sustainability. In Ghana, the picture is equally alarming. Available data indicates that NCDs amount for over 40% of all age category mortalities, and they consistently rank among the top 10 causes of death nationwide. Even more disturbing is the steep rise in hospitalized cancer cases, which jumped from 3,487 patients in 2012 to 16,105 in 2016. Alarmingly, adults aged from 18 to 45, the prime of our nation's workforce, account for more than half of these cases, 16,000 cases. This troubling trend is driven by a convergence of factors. One, shifting lifestyles characterized by things like tobacco use, alcohol abuse, unhealthy diets, and sedentary behavior, and also increased environmental factors. The cost of treatment, ladies and gentlemen, is not just disturbing, it can be devastating for low-income families. Estimates from our teaching hospitals reveal that the average annual cost of non-communicable disease treatment per patient averagely stands at approximately 53,000 Ghana cedis annually, and that's equivalent to about $3,300 US. Managing chronic conditions imposes crushing financial burdens on families, often pushing them below the poverty line and deepening their vulnerability. It is estimated that individuals diagnosed with chronic diseases face a 75% likelihood of falling into poverty within 5 years, regardless of their original economic standing. And so it even ruins rich people. I mean, you spend all your money trying to find a cure. Those battling kidney and cardiovascular diseases are reported to spend between 70% and 95% of their non-food expenditure on healthcare alone. Older adults living with chronic conditions spend 5 times more on healthcare than their healthier counterparts. Despite the important strides made through the National Health Insurance Scheme, it remains inadequate in fully covering NCD-related services and medications. In 2018, around 48% of all NHIS claims were related to non-communicable diseases. Yet essential services remain outside the NHIS coverage, leaving families dangerously exposed to out-of-pocket payments. It is against this background that shortly after my election as President, I directed the Honorable Minister for Health to initiate the establishment of the Ghana Medical Trust Fund, a commitment captured faithfully in the 2024 People's Manifesto of the National Democratic Congress. Following extensive consultations with inputs from over 3,300 stakeholders, the National Task Force I formed, ably chaired by Reverend Emeritus Professor Seth Aite, submitted its final report on April 10th this year. I'm pleased to inform you that the accompanying draft bill, as the Minister said, is ready and will be presented to Parliament when it resumes at the end of next month. Ladies and gentlemen, today we're launching more than just an initiative. We're launching hope. Hope for thousands of Ghanaians living with chronic diseases. Hope for families battling the overwhelming costs of care. Hope for a future where the quality of life is not determined by one's ability to pay for essential treatment necessary. The Ghana Medical Trust Fund will support specialist-level treatment for a range of chronic diseases, including cancers, diabetes, cardiovascular diseases, chronic kidney failure, stroke, and other complications. It will also progressively expand to cover convalescent care, palliative services, and home-based support. Support from the fund will be based on formal applications, carefully vetted, and will focus on costs not currently covered under the NHIS. The fund will operate as an independent statutory trust, governed by a board of trustees and supported by a dedicated administrative secretariat, third-party administrators, and patient navigators to ensure transparency, efficiency, and a patient-centered service ethic. Initial projections suggest the fund will require approximately 3 billion Ghana cedis annually over the first 3 years. And as was said, the main source of finance is going to come from the NHIL, the uncapped portion of the NHIL. It will also include direct budgetary support from government, voluntary contributions from corporate institutions and individuals, grants, donations, and will also be able to invest in order to raise income, investment income. Strategic procurement measures such as access pricing and framework contracting will ensure that essential medicines and diagnosis are acquired sustainably. And so I spoke to the minister and asked if we couldn't encourage our local pharmaceutical industries to increase the availability of generic drugs, which are much cheaper than the imported drugs. I know because I paid for my mother's diabetes drugs, and I know the difference between the imported drugs and the difference in cost. And so if we can encourage our pharmaceutical industry to produce generic versions of those drugs, it will bring the costs much lower. I wish to commend the exceptional leadership of the National Technical Task Force, chaired by Reverend Emeritus Prof. Seth Aite, and to extend my heartfelt gratitude to all the professional associations, religious leaders, our development partners, and citizens who contributed their expertise and passion to bring this initiative to life. Your dedication has translated a manifesto promise into a tangible, life-changing reality. On that inspiring note, distinguished ladies and gentlemen, I'm proud to officially declare, is there going to be a fanfare? Let me know. The last time when I was just declaring something launched, then I almost ran away from the stage. Okay, there's no fanfare. All right. On that inspiring note, distinguished ladies and gentlemen, I'm proud to officially declare the Ghana Medical Trust Fund, into brackets Mahama Cares, duly launched. May God richly bless all of us. But more especially, a lot of these diseases are caused by ignorance in terms of our lifestyles and all that. And so we must also, as part of the Ghana Medical Trust Fund program, launch a very strong awareness campaign so that people will know what the trigger factors for these non-communicable diseases are. I understand that some of them are genetic because you can inherit it from your parents in your genes, but a far greater number are lifestyle diseases. They are acquired, they are not genetic. And so if people just know, what their disposition is and they are able to make changes in their lifestyle, I'm sure that we should be able to bring down, the level of disease burden that we currently are seeing. I'd like to encourage all corporate Ghana, that is private sector and state sector, to annually devote a portion of their community social responsibility to Ghana Medical Trust Fund, because it's going to do a lot of good to our country. I want to thank Professor Aite, who's been my long-standing friend and mentor, for the contribution he made. Prof. Aite is a retired specialist, emeritus professor, and very well known in medical circles. And he won't want me to mention it, but I want to say that I was surprised at how much he's giving. Professor Aite, a doctor on pension, has given $1,000 to Ghana Medical Trust. And so that should encourage all of us and encourage, the corporate institutions to do even much better. But on that note, I also, as the initiator of this laudable program, would also have to give something. And so I've pledged half a year, 6 months of my salary to Mahama Cares. I'm not yet being paid. They say Accountant General is still doing something. But whenever Accountant General finishes, 6 months of whatever I'm entitled to will go into Mahama Cares.